Our doctor is a oncologist. An oncologist is a doctor who specializes in cancer treatment. Yeah, so okay, apart from the cancer treatment itself, Liberty Cancer and Wellness Center offers a holistic approach to cancer. That means we have psychosocial counseling, we have nutrition, we have a pharmacy. Yeah, so we have support group meetings. So we have all this under Liberty Cancer and Wellness Center. So it's a holistic, we offer a holistic approach towards cancer treatment.
Wow. So for people out there, some might not know what is cancer, what actually really is cancer.
Okay, I know that most people, first of all, they have this misconception that cancer is witchcraft. And when we go out there today and ask people about cancer, everyone will give their side of the story, and we have a lot of misconceptions about cancer. But actually, cancer is a disease in which the cells in the body become abnormal and they grow uncontrollably, and you find that they spread to other organs, affecting their functions. That is why you'll find that a patient who has cancer, at times they'll see that it has affected the lungs, the liver. So this uncontrolled production of abnormal cells is what causes cancer.
Wow. And who can get cancer?
Anyone can get cancer. Yes, anyone can get cancer. We have men can get cancer, women can get cancer, and even children can get cancer. Yeah, so everyone can get cancer.
So if a person has cancer, how does it start?
Okay, there are those obvious signs, like maybe a lump. I know most people know that when they have breast cancer, they develop a lump in the breast, and they will do something like a biopsy, which will confirm whether it's just a lump or it's cancerous. You know, not all lumps are cancerous. You'll find that there is a lump which is just malignant. Others is even hormonal imbalances. Yeah, so but there are also other signs, maybe like loss of weight, uncontrolled loss of weight, fatigue. Yeah, so when somebody visits a health facility, they can be able to be told that these are the tests that we can be able to carry out, which will determine whether they are cancer or not. So not all growth is cancer, or any lump is cancerous. Yes.
And can we say cancer is genetic?
Yes, it is. You'll find that if it's in a family, there is a very big likelihood that somebody in that family, maybe if a parent has cancer, you can find that there's maybe a child or somebody in that family might also have cancer. Yeah. So we also have cancer which is genetic.
Wow. Yes. And now, if we talk of the types of cancer, how many types of cancer do we have?
Wow. I think if we are to write down the list, we will not be able to finish that list, because we have a lot of cancers. We have, of course, the common ones: breast cancer, prostate cancer, cervical cancer, esophageal cancer, lung cancer, colon cancer. Yeah, we have a very long list of cancers. Yes.
And there are vaccines for cancer.
Yeah, we have HPV vaccine, which is a vaccine that prevents cervical cancer. Yeah, and it's something that we really encourage people to get this vaccine. Yes, because it prevents. Yeah, so we have HPV vaccine, and it is one of the vaccines that prevents the cervical cancer.
Wow. So let me keep Sheila busy. We have a psychosocial breast cancer. So how can one identify?
Okay, we have psychosocial dynamics of breast cancer patients, and okay, it cuts across different dynamics. Let me start with the patients that have undergone mastectomy. You find that if one patient has gone through mastectomy of either the right or the left breast, they suffer self-esteem, low self-esteem, and it really affects them so much that they are not even in a position even to face the community. And for instance, if you get somebody who is not married and they have undergone mastectomy, it really affects them even to find to find a spouse, because they are not in a position to explain how it happened, and it becomes a big challenge, and it really brings that person down. They are not able to be who they are supposed to be. We also have other patients who keep on fluctuating their HB levels, whereby today the HB is not within the normal range, and they are in and out of the hospital. So you find the breast patient cancer, the breast cancer patients, they also get affected because of that. Maybe they go through blood transfusion, and it is a psychological, it's traumatic, because you can imagine you're being transfused, and it's just because of the breast cancer. So there are so many things that go around the mind of that person who has been diagnosed with breast cancer. And what happens, we help them with the intervention. That's why as counselors, we just help them in the journey to know how to go about the managing of HB. We coordinate and work together with the nutritionist. So because these are factors that affect a person due to their maybe nutrition, maybe they're not eating properly, or they don't have the right diet, and that's why maybe they have those low HB. In such cases, I don't deal with them alone in the psychosocial dynamics. I also coordinate with the nutritionist. We work as a support system, not just alone. We have the nurses who are able to advise and give the way forward. So when we talk about the breast cancer psychosocial dynamics, they cut across. We also have the issue of maybe those people are not able to eat properly because of the chemo. We have the chemo side effects, which are very severe, maybe nausea every other time. So you find these patients, they are always low. They have low self-esteem, they have a lot of anxieties, they don't know what is the next thing, and it really puts them down. But as counselors, we intervene by helping them through the journey, just to allow them know that the chemodynamics are not forever. It is just going through some cycles, and after the cycles, they do assessment with the oncologist, and it gets better. Just helping them to instill that esteem, yes, and to get rid of the anxieties whatsoever.
So is there like, for how long will this person take to be treated breast cancer?
That one will depend, because as I have said, there are people who go through mastectomy, and there are others who don't go through mastectomy. So the treatment varies. That one depends on the oncologist, the way the oncologist will prescribe. Yes.
And does this affect their mental health?
Yes, it affects their mental health, because you see, this is a new thing to them, and maybe it is their first time, maybe they have not heard of it in the family. You can just find even some patients are rejected even from the family. They go through rejection, and once they feel rejected, they feel not part and parcel of the family. That ends up affecting them mentally. Yes.
Wow. And now about the psychosocial dynamics of the prostate cancer. How do you go about it?
Okay, first of all, about the prostate cancer patients, one of the psychosocial dynamics I've seen is once that person is married, and maybe they have gone through either surgery, or they have those symptoms that they are not able to pass urine. They may not be active in their conjugal rights if they are married. That is the major psychosocial problem. But we are able to help them now in marriage counseling, whereby if they are married, you take them through counseling together with the wife, and you're able to explain to the wife until they are able to finish the treatment, is when maybe they will continue with their conjugal rights.
Okay.
Yes.
And if a person who has prostate cancer comes and their mental health is not okay, and maybe their spouse don't understand why is this happening, how will you help such a person?
That is where we intervene as counselors, and it is not a tough journey when a counselor intervenes, because the issue comes in when the wife is not able to understand why can't we have this.
Yeah.
But when it is well explained that this is a journey and it is something that is able to be treated, they're able to understand easily. And they're able to be comfortable even with the waiting period.
Okay.
Yes.
Now back to you, Eve.
Yes.
How can you prevent cancer?
Okay, you know, we are looking at the lifestyle here. So you find that at times our lifestyle is what causes cancer. But some of the things that we can do to prevent, we need to get vaccinated. We talked about the vaccine also. We need to get regular medical checkups. And I know this is a challenge with most people. When we call out for screening, you find that most people do not come. And let me even single out men. At least the ladies watajitokeza na wakuje kwa wingi for the breast cancer screening and cervical cancer screening. But men, it's very hard to convince them to come for the screening. But regular screening, we say that early detection saves lives. So we call people out there to make sure that they get regular screening. Exercise regularly, mazoezi muhimu sana. Avoid drinking alcohol. Eat healthy diet. And also we need to, like cervical cancer, we need to avoid risky sexual behaviors. For example, unsafe sex and having maybe sexual intercourse with many partners. Yeah.
Wow. And now I think the last question as we're wrapping up because of time. So after cancer diagnosis, what is next?
Okay, after the cancer diagnosis, we have various treatment for cancer. We have chemotherapy. I know that many people know about chemotherapy. We have those who will go undergo surgery. We have radiotherapy. We have hormonal therapy. We have immunotherapy. So after cancer diagnosis, once one gets the doctor who is the oncologist, this doctor will be able to guide them on the process of the treatment. And I'm happy to tell you that we have people who go through the treatment and they are okay, and they go back to their daily activities. So as most people might say that cancer is a death sentence, it's not a death sentence, because we have people who have, we call them the cancer survivors, where the warriors who have gone through the treatment and they are doing well.
Wow.
Yes.
Wow. I wish we had more time, but because of time, I would like to give you a parting shot as you tell people how can they find you.
Okay. My parting shot this morning is that let's get screened, as we know that early detection saves life. If you get detected early, you will be able to be assisted and you will get treated. And for anyone who wants to find us here in Nakuru, we are located at Assumption Center, third floor. Our facility is called Liberty Cancer and Wellness Center. We offer cancer screening. In fact, October being a breast cancer awareness month, if you will look out at our pages, you might have the cancer screening. We offer oncology consultation. We do chemotherapy. We have pharmacy services. We have psychosocial counseling. We have nutrition counseling. We have patient support. We have palliative care. And we have a lot of services that dwell around cancer treatment. And if you have any questions that you want to ask, you can get us through our phone number, which is 0790 658 888. 0790 658 888 is our phone number.
Wow. Back to you, Sheila. Give us your parting shot.
Okay. My parting shot is for those who go through cancer and most of them are in denial, I request that don't be in denial. We are here to help. As a counselor, I'm here to help you go through the psychological issues, spiritual, and we are able to help so that you don't go through the anxiety when you're going through the treatment. So seek help, find us at Liberty Cancer and Wellness Center, and we are able to intervene. Thank you.
Wow. Thank you even for honoring the visitation and the invitation. Don't take it for granted. This has been the Morning Dew Show, and of course Wanyama ameamua ende hiyo side ingine kidogo, but kesho utamwona hapa venye takuwa mkali na kaka story kake ni moto, so wait until tomorrow and for sure God will bless you. And remember, today being a Tuesday, we have a deliverance service right after this. So don't touch that dial. This is the service that will take you to another level. This is the service that opens gates for you, paves way for you. Watch this service, attend this service, and God will surely increase you. God will open your eyes and see what is happening to your life that is not correct, that needs to be rectified. So tune into this service and follow our social media pages. That will be Mountain of Deliverance Church, and YouTube, Rev Francis Oracle will be live on our social media pages, and God will bless you. Until tomorrow, I have been your host, Trevilla Luta.